Hello, my name is Cristina Besada. I work in the Hospital Italiano de Buenos Aires in Argentina, in charge of the neuroradiology, and we want to show you the ears of the lynx, that it's a hallmark sign in hereditary spastic paraplegia with thinning of the corpus callosum. So in our case, he started in 2014 with poor school performance, some speech disorders, and frequent falls. 1 year after, he developed cramps and paresthesia with gait disorder and weakness. And in 2019, he had a gait worsening with predominance of lower limbs, severe cognitive decline, and he walked with support. So we face a patient that started as adolescent with no relevant family history, and he had a cognitive impairment and a progressive pyramidal syndrome. His laboratory tests were normal. He went through 2 MRI with similar findings, non-specific brain abnormalities such as brain and spinal cord atrophy, and hyperintensity of the white matter. There was also severe atrophy of the corpus callosum, especially at the rostrum. Here in this zoom image, you can see it very well. It was really severe. And as key findings, we also take a look at the hyperintensity, and one of the fellows found it that it was, the morphology was funny with these tips at the frontal area. And he consulted, and we went to see the bibliography to see if there was any reports regarding with the anatomy, with the pathology. And we found that this sign was already reported as an abnormality in the forceps minor of the corpus callosum, corresponding to the genofibers, which appear hypointense in T1 and resemble this animal, that is a lynx. The lynx are wildcats that have characteristic long ears with a kind of long tuft of hair in the tip of the ears, which resemble the hypointense tips in this pathology in T1, and in T2 and flare, it becomes hyperintense. Here you can see it very well. So suspected diagnosis is hereditary spastic paraplegia with, but there are still 79 subtypes. So these are disorders genetically determined, which main symptom is the lower limb spasticity. They affect the corticospinal tracts and also may affect the cerebral cortex and the cerebellum. It is not very frequent, 2 to 5 per 100,000. And there's a genetic classification with more than 79 variants and counting, dividing these entities into autosomical dominant, autosomical recessive, and X-linked. There's also a clinical classification into pure and complicated depending on the systems affected. In this drawing, you can see the complexity of these disorders in terms of clinical and genetical, point of view. We can see our patient into this group with the intellectual disability and the abnormal brain image. If we, with the MR findings, we contribute with the thin corpus callosum, that, but you can see that there are still many variants into this group. So if you now add the year of the lynx sign, now you have only 2 variants left. So if you are in the context of a progressive spastic paraplegia and it's hereditary and it's autosomal recessive, and there's a thin corpus callosum, and you can see the ears of the lynx, then you have only 2 genetic subtypes variants. And this patient was number 11. This is the most frequent form into these disorders, autosomic recessive with thin corpus callosum. The clue MRI sign is the ears of the lynx. Clinically, they start between the age of 4 and 36, and from the point of view of the clinical classification, these are complicated. They begin usually with cognitive decline and progressive with motor disorders. In summary, these disorders with the thin corpus callosum are an independent entity into the wide group of progressive degenerative disorders. The presence of the sign of the ears of the lynx in the context of an atrophy of the corpus callosum is a major hallmark of this autosomic recessive disorder. When this radiological sign is depicted, then there's a high likelihood of a genetic mutation associated with number 11 and 15. Hopefully, these findings may help to unveil this the pathogenesis that is still unknown of these diseases, and help the clinician in this challenging diagnosis to avoid unnecessary genetic tests. This is our group, and I want to remark to our fellow Emiliano Ruiz Romagnoli, who is one of the authors and the one who depicted, in this case, this sign in first than anyone. So thank you very much for your attention.